Ever wonder why your stomach hurts after eating a spicy meal? Or why you sometimes feel bloated and uncomfortable? What you're feeling could be more than just a one-off discomfort. You might be experiencing a digestive disorder. The digestive system, our body's unsung hero, is a complex network of organs working together to break down food, absorb nutrients, and eliminate waste. But when this system is disrupted, a myriad of issues can arise, ranging from mildly annoying to seriously debilitating. Peptic ulcers, diarrhea, constipation, gastroenteritis, pancreatitis, inflammatory bowel disorder, and hemorrhoids are just a few examples of common digestive disorders. Each of these conditions has unique symptoms and causes, and understanding them is the first step towards effective management and treatment. So, if your tummy troubles have been bothering you more than they should, it's time to take them seriously. Stick around as we dive into some of the most common digestive disorders and their impacts on your body. Imagine having a painful sore in your stomach or upper part of your small intestine. That's what we call a peptic ulcer. Now let's dive into what exactly a peptic ulcer is. It's a sore that develops on the inner lining of your stomach, upper small intestine, or lower esophagus. The most common cause, a bacterium known as Helicobacter pylori or H. pylori. Other factors like frequent use of pain relievers and excessive alcohol can also contribute to this condition. So how would you know if you have a peptic ulcer? Well, the most common symptom is stomach pain, which might feel like a dull ache or a burning sensation. But don't mistake it for hunger pangs, as it can sometimes worsen with meals. Other symptoms might include bloating, nausea, and an unexplained weight loss. Now, it's time for the good news. Peptic ulcers are treatable. Your doctor might prescribe medications to reduce stomach acid and antibiotics to combat H. pylori. In some cases, lifestyle changes like avoiding spicy foods, alcohol, and smoking can also help. Remember, it's crucial to seek medical attention if you experience symptoms like severe abdominal pain, bloody or black stools, or persistent vomiting. These could indicate complications such as bleeding, perforation, or obstruction, which require immediate intervention. So, the next time you have a persistent stomach ache, don't ignore it. It could be a peptic ulcer. Ever had an upset stomach leading to frequent trips to the bathroom, or the exact opposite, constipation? Let's dive into these two common digestive issues: diarrhea and constipation. Diarrhea is characterized by loose or watery stools, usually occurring more than 3 times in a day. This condition can be acute, lasting only a couple of days, or chronic, persisting for weeks. Causes range from bacterial or viral infections to food intolerances and certain medications. Symptoms often include abdominal cramps, bloating, and in severe cases, dehydration. On the other hand, constipation is the infrequent or difficult passage of stool. This can be due to a lack of fiber in the diet, insufficient fluid intake, or a side effect of certain medications. You might experience symptoms like feeling bloated, discomfort, and the sense of incomplete evacuation. Treatments for diarrhea and constipation often involve changes to your diet and lifestyle. For diarrhea, staying hydrated is crucial to replace lost fluids. Eating small, light meals can also help. For constipation, increasing your fiber intake with foods like fruits, vegetables, and whole grains can make a big difference. Regular exercise helps too. In both cases, it's important to seek medical advice if symptoms persist, as they may be signs of more serious underlying conditions. So the next time your digestive system throws you a curveball, remember these tips. And most importantly, remember, staying hydrated is essential when dealing with these conditions. Now, let's talk about 2 conditions that sound similar but are quite different: gastroenteritis and pancreatitis. First up, gastroenteritis. Often called the stomach flu, gastroenteritis is an inflammation of the lining of the intestines. It's usually caused by a virus, bacteria, or parasites. When these bugs make their way into the gut, they can cause a lot of discomfort. Symptoms typically include nausea, vomiting, diarrhea, and abdominal pain. Dehydration can also be a major concern with gastroenteritis, so it's important to keep fluids up if you're suffering from this condition. As for treatment, in most cases, gastroenteritis resolves on its own. Rest, hydration, and over-the-counter remedies can help manage symptoms. However, if symptoms persist, it's important to seek medical attention. On the other hand, we have pancreatitis, an inflammation of the pancreas. Unlike gastroenteritis, pancreatitis is not caused by a bug. Instead, it's often due to gallstones or heavy alcohol use. Pancreatitis can be acute, meaning it comes on suddenly and lasts for days, or chronic, where it occurs over many years. Symptoms can range from upper abdominal pain, fever, and rapid pulse, to nausea, vomiting, and weight loss. Treatment for pancreatitis often involves hospitalization to manage pain and complications. In some cases, surgery may be needed to remove gallstones or parts of the pancreas. In essence, while both gastroenteritis and pancreatitis involve inflammation, they affect different parts of the digestive system and have different causes. It's also worth noting that while gastroenteritis is usually a short-term illness, pancreatitis can lead to serious complications if not treated promptly. So, if you experience persistent symptoms like severe abdominal pain, vomiting, and diarrhea, it's always a good idea to seek medical advice. Self-diagnosis can be risky business when it comes to digestive disorders. While these conditions may sound scary, with the right treatment and care, they can be managed effectively. Ever heard of IBD or hemorrhoids? These are common conditions that can cause a lot of discomfort. Let's dive into the world of inflammatory bowel disorder, often abbreviated as IBD. This is not a single disease but a term that covers a group of chronic inflammatory conditions of the digestive tract. The two main types are Crohn's disease, which can affect any part of the digestive system, and ulcerative colitis, which specifically targets the colon and rectum. Common symptoms include abdominal pain, diarrhea, weight loss, and fatigue. So what causes IBD? Well, it's thought to arise from an abnormal immune response to the microorganisms in our guts, possibly triggered by genetic or environmental factors. However, the exact cause remains a mystery. Treatment for IBD usually involves medication to reduce inflammation and prevent flare-ups, dietary changes, and in severe cases, surgery. Now let's switch gears and talk about hemorrhoids, another condition that affects a significant number of people. Hemorrhoids, also known as piles, are swollen veins in the lowest part of the rectum and anus. They're a bit like varicose veins, but in a place where you really don't want them. Hemorrhoids can be internal or external, and they can cause symptoms such as rectal bleeding, itching, and discomfort. Causes include increased pressure on the veins in the pelvic and rectal area from straining during bowel movements, sitting for long periods, pregnancy, and obesity. Treatment for hemorrhoids can range from home remedies like warm baths and over-the-counter creams to medical procedures or surgery for more severe cases. Both IBD and hemorrhoids can significantly impact a person's quality of life. But remember, these conditions are treatable, and many people with them lead full and active lives. As with all medical conditions, early detection and proper treatment can make a world of difference. So don't hesitate to reach out to a healthcare professional if you're experiencing any concerning symptoms. Now that we've taken a journey through the world of digestive disorders, it's clear that our digestive health is crucial. From the onset, we've learned that these disorders are more than mere discomforts. They are serious conditions that can drastically affect one's quality of life. Peptic ulcers, for instance, are more than just stomach aches. They are open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. They are often caused by an imbalance between digestive fluids in the stomach and duodenum. Then we delved into the contrasting conditions of diarrhea and constipation. Diarrhea, characterized by loose, watery stools and constipation, a condition where bowel movements are infrequent or hard to pass. Both pose serious health risks if not managed properly. We also ventured into the realms of gastroenteritis and pancreatitis. Gastroenteritis, an inflammation of the gastrointestinal tract, and pancreatitis, an inflammation of the pancreas, can both lead to severe complications, including dehydration, malnutrition, and even organ failure. Lastly, we explored inflammatory bowel disorder and hemorrhoids. Inflammatory bowel disorder, which includes conditions like Crohn's disease and ulcerative colitis, is a chronic inflammation of the digestive tract that can cause severe discomfort and complications. Hemorrhoids, on the other hand, are swollen veins in your lower rectum and anus, which, while not usually dangerous, can be incredibly painful and impact your daily life. In wrapping up, it's important to remember that these disorders are not just words on a page or conditions you learn about in a medical textbook. They are real, tangible issues that millions of people around the world grapple with every single day. Understanding them, their symptoms, causes, and treatments is the first step towards better digestive health. Remember, your health is your wealth. Subscribe for more because you won't find me later. Together, let's continue exploring the fascinating world of medical science and unravel the mysteries of the human body.